If the patient is suffering with a neck pain, the very wonderful area in the human body, if we do the bleeding from this area, we can see the very wonderful results. अब मैं आपको दिखाता हूं ये एरिया कौन सा है. So let's see here. So we know the location of urinary bladder body here. So generally we are talking about the location of urinary bladder body here. हमारे घुटने के बीच में सेंटर में UB40 पाया जाता है. Exactly in the center, that is the location of UB40, right? ये हमारा UB40 है. Okay. Now from the UB40 we go 4 finger down, 4 finger up, 4 finger right, and the 4 finger left. This entire area is very good for neck pain and the lower back pain. Lower back pain. Right? This entire area is called occiput area. Occiput means सिर के पीछे का भाग. ऐसे कहा जाता है कि यार तुम्हारी अकल घुटनों में है क्या? सुना है ना आपने कि तुम्हारी अकल घुटनों में है. ये बात सही है. हमारी अकल घुटनों में होती है क्योंकि घुटनों में हमारा ब्रेन होता है. सो नी इज लाइक ए ब्रेन. सो फ्रॉम द नी वी कैन सी द नी आईज. घुटनों की आंख पता है हमको. घुटनों की आंख से हम ये वाली आंखें ठीक कर सकते हैं. सो नी इज लाइक ए ब्रेन. फ्रॉम द नी वी कैन ट्रीट अवर brain. If we are going on the back side, that is the back side of the brain or the occiput. So when we are going on the back side, हम घुटने के पीछे जाते हैं, हम नी एरिया के पीछे जाते हैं, popliteal area में जाते हैं, that is occiput area. We can needle there, we can do massage there, we can put the acupressure there, or we can blood lead there. And we can work on the neck pain. Wonderful area. Remember one thing, कि whenever we do bloodletting, we always do bloodletting on the same side. Like in the needle, there are many concepts. In the TCM, we are using the needle on the same side. हम TCM में needle उसी दिशा में लगाते हैं. उसी in the master tooth, we are using the contral needle. Means problem is this side, we are putting needle on the other side. But when we talk about the bleeding, always we do on the same side. So this is the first point, UB40. You can always give this point for quick results and which will appear immediately in your clinics on spot results, neck pain and lower back pain. Now second, sometimes patient is having very different type of the neck pain. कई बार patient को एक अलग तरह का neck pain होता है. So we are telling that restricted neck rotation. Patient की गर्दन घुमाई. Okay, it's going nicely. Now this is restriction. So when there is a restriction in the rotation, there is a very special point we have to add. हमें एक बहुत ही स्पेशल पॉइंट ऐड करना होगा. अगर पेशेंट की गर्दन में रिस्ट्रिक्शन है, whether on the right side restriction or on the left side restriction. What is the name of point? I will show you now. So let's see. अब हम आपको अगला पॉइंट दिखाएंगे जिसका प्रयोग हम करते हैं for the restriction of neck. So this is the point. Let's hear spleen 4. We know this is the spleen 4 point here. Spleen 4, one of the great point. Spleen 4 is the point of TCM. Spleen 4 point is the EOB, extraordinary vessels. Spleen 4 एक बहुत ही बेहतरीन point है. So this is the location of spleen 4. we can see here spleen 4, right? So now if we see here, this is the bony part, ये हमारा bony part है। इसके पहले spleen 2, इसके बाद spleen 3, then we can feel the depression here, that is the location of spleen 4, ये हमारा spleen 4 है, right? So spleen 4 point located here, which is the very good point for restriction in rotation of the neck. Now, इसके रूल तो हम जानते हैं। Whenever you want to put the spleen 4 point, जब भी आप spleen 4 point लगाना चाहते हैं, so there is a rule. What is the rule? For the male, put the spleen 4 on the left side. Spleen 4 को लेफ्ट में लगाइए, and for the female, put the spleen 4 on the right side. And wherever you are putting the spleen 4, आप जिस भी दिशा में spleen 4 लगाते हैं, because spleen 4 is the master point, so we are putting on the left side for male, and spleen 4 we are putting as a master point on the right side for female. क्या हुआ जी? Everything is okay? म्यूट कर दूं सबको? डरा दिया मुझे। मैंने कहा क्या बात है, कोई कंप्यूटर से निकल के इधर ही आ गया क्या? ओके जी, भैया डराइए मत, थोड़ा धीरे आवाज करिए। So spleen 4 is the master point. Whenever we put the spleen 4 in the opposite side, we can put pericardium 6. Whenever we put a spleen 4 on the opposite side, we can put pericardium 6, right? So spleen 4 we are using when there is a rotational problem, restriction in the rotation. I can move my neck on the right side, but I can't move my neck on the left side or anywhere. Okay, done. Next point. तो ये हमारे एड ऑन पॉइंट है। जब भी हम ऐसे पेशेंट का ट्रीटमेंट स्टार्ट करेंगे, we can start from the spleen 4. Now, sometimes what's happening, patient is having we will talk about the one or two more point of the spleen, then we'll proceed ahead. फिर हम आगे बढ़ते हैं, हम एक दो स्प्लीन के पॉइंट और भी समझ लेते हैं। स्प्लीन many times person losing kidney energy. आपको पता है किडनी एनर्जी लूज करने के क्या कारण होते हैं? You know that. Many times we are losing the kidney chi, right? Suppose I am studying throughout the night because of my exam is there. So if the person is not sleeping in the night, will lose the kidney chi or not? अगर एक व्यक्ति रात्रि को आराम नहीं करता, किडनी की ऊर्जा लॉस्ट करेगा कि नहीं करेगा? करेगा, यस करेगा। If the male or female are indulged in the actual excessive sexual intercourse and if they feel weak, अगर वो ज्यादा सेक्सुअल इंटरकोर्स में इन्वॉल्व होते हैं और इसके बाद उनको अगर कमजोरी लगती है, कई मेल और फीमेल, maybe only one will tell you after the sexual intercourse I feel weak, I feel lower back pain, I feel giddiness, I feel vertigo, I feel like floaters in my eyes, कि कई लोगों को सेक्सुअल इंटरकोर्स के बाद ऐसा फील होता है। वो कमजोरी की निशानी है. बिकॉज इन द सेक्सुअल इंटरकोर्स we are using the energies of kidneys. We are having two kidneys. In between, we are having Mingmen chakra, where we have our kidney energies. We are losing in the sexual intercourse. So those who are not having any problem, I'm not talking about them, but some of the person are getting different issues. किसी पेशेंट को चेहरे पर नमनेस आती है, किसी पेशेंट का पाल्पिटेशन बढ़ जाता है, एक एक दो दो दिन तक पाल्पिटेशन बना रहता है, because of poor kidney chi. So the person is having neck pain, lower back pain, or there are many problems in the body due to the kidney chi deficiency after the sexual intercourse. अगर वो ऐसा होता है, if it is happening, and we know there are many other regions where kidney chi is getting deficient, और भी कई कारण होते हैं. During the menstrual cycle, if the female are doing intercourse, there is very fast degeneration of kidney. Menstrual cycle के समय बहुत ही जल्दी किडनी एनर्जी का डिजनरेशन होता है if the females do sexual intercourse. Okay. Not only this, even watching the porns also reduce the kidney chi. Now the other reason, if the person is standing throughout the day, अगर व्यक्ति सारा दिन खड़ा रहता है, because maybe a person is having, like suppose some of you are a speaker, some of you are doing some classes, you are a teacher, you are doing some workshops, and you are standing throughout the day. Or maybe females are standing in the kitchen, they are standing throughout the day, पूरे दिन खड़े रहती हैं, तो उससे भी उनकी किडनी की चीज कमजोर होती है. The kidney is sense reducing if the person is doing overstanding, right? So we can see kidney chi might, there are many reasons person might lose the kidney chi. Kidney chi you can consider कि आपके तिजोरी में धन है, अब आप उसे संभाल के यूज करो या ज्यादा यूज करो. Definitely if you are using, then you should you keep on refill it. So what to do if the person is having neck pain? Then there is wonderful points in this condition. In this condition, if the person is losing the kidney chi, if the person is losing the kidney essence and having any type of the issue like the neck pain, lower back pain, middle back pain, we are having wonderful points. Now I will tell you, there are 2 points we have to add. ऐसे 2 बिंदु हैं जिनको हम ऐड करेंगे गर्दन दर्द के लिए. तो कोई व्यक्ति जब बोलता है कि मुझे गर्दन में दर्द हो रहा है, तो पता करो कहीं इसकी किडनी की ऊर्जा कम तो नहीं हो रही है भाई, है ना? तब आप ट्रीटमेंट करिए. सो देयर आर 2 add-on points. I will tell you the first and the very wonderful add-on point, or we can tell the number 1 add-on point will be spleen 6. Spleen 6, right? Spleen 6, one of the great point, बहुत ही शानदार point है spleen 6. Because we already know there are 3 meridian crossing the spleen 6: kidney meridian crossing, spleen meridian crossing, liver meridian crossing. All the 3 meridian also crossing the genital part, and there are many other part. We can see it is a 3 chun up. ये हमारे medial malleolus से 3 chun ऊपर पाई जाती है, पाया जाता है spleen 6. So this is the location of spleen 6. From the medial malleolus, it is a 3 chun up, 3 chun proximal. And this is the union point of all the 3 meridian, whether we talk about the spleen, meridian, liver, meridian, the kidney meridian, all the 3 meridian crossing this. तीनों के तीनों meridian इसे cross करते हैं, right? So now, in this way, if we put the needle here, it's improving the neck pain while improving the kidney chi. So now the second point, which we should also know, एक दूसरा बिंदु है. So we are using 2 points. The second point, that is the kidney 3. Kidney 3 is the source point of the kidney, and it is a great point of the kidney. It's improving the kidney chi. So we can see here the medial malleolus, and just on the back side of the medial malleolus, ये हमारा kidney 3 point है. So this is the location of kidney 3. Medial malleolus. Now from the medial malleolus, if we go on the back side, that is the location of kidney 3. Kidney 3 is the very good point of kidney. It is the source point of kidney. हमारे किडनी का source point है, right? So we can put the needle here, we can put the magnets here, we can tonify, we can put in the body, we can put in the sujog. So finally there are 2 points. हमारे 2 point है kidney 3 and spleen 6 bilateral. If we put them bilateral, we can improve the kidney chi, we can improve the kidney sense, and we can work on the neck pain. Even spleen 6 enough. Sometimes spleen 6 enough, and it's a very powerful point, right? Done. Many times person is having neck pain. Now moving to the next point. Add on. कई बार व्यक्ति को गर्दन में दर्द होता है, लेकिन गर्दन के साथ साथ हाथों में भी होता है. The person is having neck pain, and with the neck person is also having arm pain. उसके साथ साथ उसे हाथों में भी दर्द होता है, right? Okay. So now let's see here what to do in this condition. So now look at in this image first. If you see here, this is the spleen 6. ये हमारा spleen 6 है, और ये हमारा spleen 7 है. Spleen 6 is 3 tune up, then spleen 7 is again 3 tune up. So we can see there are 2 wonderful points here, spleen 6 and then the spleen 7, right? The area in between the spleen 6 to 7 is the one of the great area. ये area बहुत ही शानदार है. We should massage here. हम यहाँ पर मसाज कर सकते हैं. If the person is having neck pain with the arm pain, गर्दन में दर्द है, लेकिन arm में भी है, right? And there are very special point, just 1 tune up from the spleen 6. हमारे spleen 6 से ठीक 1 tune ऊपर एक point होता है. That is a great point for arm plus neck pain. तो मास्टर टंग ने भी इस पॉइंट को बोला है 77.20. मास्टर टंग इस पॉइंट को बोलते हैं 77.20 as per the master tongue from the medial malleolus. If you are coming 3 tune up, that is spleen 6. But if you go come one more tune up, that is 77.20, and it is the great point for the arm plus neck pain. अगर हमारे स्प्लीन 6 से आप 1 चुनू पर आते हो और वहां पर दबा के देखना आहासी पॉइंट मिलेगा, उसी को ट्रीट कर देना. ट्रीट दैट पॉइंट. That is one of the great point for neck pain with arm pain, right? So we can touch, we can press bilateral and see which side is more painful, and the side is more painful. You can use only that side. आप केवल उसी तरफ लगा दो जहां पर दर्द ज्यादा है. तो दोनों तरफ पाल्पेट करके देखो, और जहां पर भी आपको लगे कि यार इधर ज्यादा ही दर्द है तो उधर लगा दो. तो हमने देखो स्प्लीन में 3 पॉइंट समझे. वी हैव टॉक्ड अबाउट 3 पॉइंट, स्प्लीन 4, देन द स्प्लीन 6, then this is the next point. We can consider spleen 6.5, right? Spleen 4, if the person is having neck pain while twisting the neck, spleen 4. Spleen 6, if the person is having neck pain due to the kidney deficiency, kidney chi deficiency, kidney essence deficiency, kidney yin deficiency, kidney yang deficiency, any type of the kidney deficiency, spleen 6, right? Then spleen 6.5 means 1 tune up from the spleen 6, that neck pain with arm pain. Let's move ahead. कभी कभी गर्दन में दर्द होता है, क्यों? नर्व कंप्रेशन के कारण. Because from the neck The lots of nerve is coming out from the C5, C6, C7, C8, sorry, C5, C6, C7. Then the T1 nerve are coming out, right? Lots of nerve are coming. Cervical nerve, then the thoracic nerve. Then these nerve are making the plexus, that is called brachial plexus, and going in the arm. तो हमारी गर्दन की नर्व जब निकलती हैं गर्दन से, एग्जिट करती हैं, सारी नर्व मिलकर एक प्लेक्सस का निर्माण करती हैं, और वो प्लेक्सस हमारे आर्म में जाता है, राइट? If the person is having neck pain, the person might suffer with the pain in the arm. The person might suffer with the pain in the elbow, in the wrist, in the finger, numbness in the finger. So whatever is happening because of the nerve problem, if there is involvement of the nerve, अगर किसी नर्व का इन्वॉल्वमेंट होता है, so there is a very special point for this purpose. इसके लिए बहुत ही स्पेशल पॉइंट है. If there is a nerve problem of the neck, so let's see here. Very, very special. So the name of this point is gallbladder 41. Gallbladder 41 is one of the great points for nerve issue, nerve problem, anything which is connected with the nerve. अगर कोई भी nerve का issue है, we can put the gallbladder 41. हम gallbladder 41 का प्रयोग कर सकते हैं, right? So we can see in this image, जब पैर को ऐसे हमने stretch किया, we are stretching the leg, feet. We can see the depression here. We can find the depression here. Then we can find the tendon here. Then crossing the tendon, this is the point. After crossing the tendon, we can feel this point. So this is the point that is called gallbladder 41. So remember one thing, we have to cross the tendon, then only we will reach on this point. हमें इस tendon को cross करना है, तब भी हम इस point पर पहुंचेंगे. So this is the location of gallbladder 41, which is one of the great points for nerve issue, for nerve compression. Again, look at this tendon. आप ये tendon को देखिए. So if you see this tendon, before the tendon, this is the point gallbladder 41. If you go after the tendon, that is the gallbladder 42. ये हमारा gallbladder 42 है. तो remember one thing, proximal to the tendon, that is gallbladder 41. और इसे आप थोड़ा palpate करके यहाँ पर needle लगा सकते हैं, right? तो हमारा किस लिए है, ये है point बिंदु. This point is for nerve issue. So now person is having neck pain, right? You can, when we talk about the gallbladder 41 is one of the very, very sensitive point, very, very important point, very sensitive point. ये बहुत ही sensitive point, right? क्योंकि gallbladder 41 is affecting our entire nerve of the brain, entire nerve of the head. हमारी सारे head की nerve को ये if affect करता है, right? We can use bilateral or we can use on one side. हम एक तरफ यूज कर सकते हैं, और we can use bilateral. Because gallbladder 41 is also the point of EOV, extraordinary vessels. ये भी हमारा extraordinary vessels का बिंदु है. So what we can do, we can put this point for male on the left side, and for female we can put on the right side, right? So this is gallbladder 41 is the very good point for nerve pain, right? And wherever we are using this point, in the opposite we can use triple wormhole 5. In the opposite we can use triple wormhole 5. Triple wormhole 5 is the couple point. Is, I think it's clear now. Okay. तो हमें देखना होगा इस तरह से. So in this way we can do, suppose we are not sure whether to tonify or the sedate, we can do the even method. अगर हमें नहीं पता कि हमें टॉन करना, sedate करना, we can do even method. So this was our next point, that is the gallbladder 41. हालांकि gallbladder 41 के बहुत प्रयोग हैं. Gallbladder 41 is the point we are using in multiple problems because whenever we are having swelling anywhere in the body, we can treat with the help of gallbladder 41. Gallbladder 41 reducing swelling in any body part. हमारे शरीर के किसी भी भाग में होने वाली सूजन को भी कम करता है. राइट, चलिए. Now we are talking about the next point. Many people are having, nowadays people are sitting with a mobile all the time, or they are leaning forward all the time. आगे झुके के काम करते हैं. The many people are leaning forward all the time, working on the mobile most of the time, right? So during this condition where the person is leaning forward all the time, working on the mobile most of the time, so they are suffering with a forward neck. उन्हें forward neck हो जाता है. They are suffering with the rounded shoulder. उनके shoulder आगे की तरफ और rounded हो जाते हैं. When the person is having forward neck or rounded shoulder, there are one more chances this thoracic cavity will be becoming narrow. thoracic cavity थोड़ी सी सिकुड़ जाती है, narrow हो जाती है, सिकुड़ जाती है और narrow हो जाती है. Right? Fine. So now what is happening, I will tell you again. तो जब thoracic cavity सिकुड़ जाती है, when thoracic cavity become narrow, heart is getting congested. Okay, that's why nowadays it's very common to suffer with a heart problem if the person is working with a computer under the air conditioned room for 8 hours every day. तो ये हार्ट के प्रॉब्लम होना बड़ा ही कॉमन हो गया क्योंकि उनका हार्ट कंस्ट्रिक्ट हो जाता है. हार्ट इज गेटिंग constricted, heart is getting very narrow space, very small space, and person is getting some problem which is connected with the heart. Okay, this is the one story. There might be some other story. अलग stories भी हो सकती हैं. Person is having some emotional issues, and because of any reason, if the person is having heart problem, sometimes this heart issue also creating the neck pain. Which is the point? कभी कभी व्यक्ति को जब इमोशनल इशू होता है ना, तभी उसको गर्दन में दर्द चालू हो जाता है. पर्सन इज सफरिंग विद नेक पेन आफ्टर सम इमोशनल शॉक. देयर इज अ वेरी गुड पॉइंट फॉर दिस. इसके लिए एक बहुत ही शानदार बिंदु है. आई विल टेल यू. सो दिस पॉइंट विल बी वर्किंग फॉर द नेक पेन if this neck pain is because of the involvement of the heart, and I will show you the location of this point now. Very important point, that is governing vessel 16 or the due 16. ये हमारा due 16 point है. due 16 point we know from the hairline. This point is little up. अगर हम hairline से, अगर हम हमारी hairline से, posterior hairline से अगर हम ऊपर जाते हैं, we are finding one depression. जब हम हेयर लाइन से थोड़ा ऊपर जाते हैं तो हमें एक नेचुरल डिप्रेशन मिलता है. ये पीछे क्यों मिलता है? आप अपने पीछे बालों से थोड़ा ऊपर जाइए और वहां पर पीछे की ओर आपको एक हल्का सा डिप्रेशन मिलेगा. राइट? सो लेट्स सी हियर वंस अगेन. आप एक पुनः देखिए. सो फ्रॉम द पोस्टीरियर हेयर लाइन, if we are going little up, we will find one depression here, that the due 16 point. This point is directly connected with the heart. ये बिंदु हमारा हार्ट से कनेक्टेड है. This point is one of the great point who is treating the neck pain. ये हमारे गर्दन के दर्द को दूर करने वाला बिंदु है. जब भी किसी को नेक पेन हो, Whenever the person is suffering with neck pain, you can press this point. इस पॉइंट को निडल लगाने में सावधानी रखनी पड़ती है। कहते हैं कि डोंट पुट द निडल मोर देन 1.5 चुन। 1.5 चुन बहुत लंबा होता है, ये इतना, लेकिन हमारे पास जो 1 चुन की निडल होती है वो सेफ है। Precautionary, you can just put the half chun needle. There is no problem. There is no problem till the 1.5 chun, but after the 1.5 chun, there is a medulla oblongata. वहां पर मेडुला ऑब्लोंगेटा है, तो मेडुला ऑब्लोंगेटा में निडल लगाने की क्या जरूरत है ना, कोई जरूरत नहीं है। So just put the half chun needle or do the acupressure here. When the person is having neck pain, you just press this point. Person will be having pain on this point. जब भी किसी व्यक्ति को गर्दन का दर्द होगा तो इस पॉइंट पर से जरूर दर्द मिलेगा। The person will be having pain at this point. So this is governing vessel 16. कितना ऊपर होता है हमारी हेयर लाइन से? लगभग 1 चुन ऊपर होता है, लगभग, यानी इट माइट नॉट बी 1 चुन, थोड़ा कम ज्यादा हो सकता है, थोड़ा कम हो सकता है, इट माइट बी 0.8 चुन। तो हमारी पोस्टीरियर हेयर लाइन से अगर हम ऊपर जाते हैं तो हमें जो डिप्रेशन मिलता है वही हमारा गवर्निंग वेसल 16 है। दैट इज अ पॉइंट गवर्निंग वेसल 16। दैट इज ऑल्सो स्पेशल मर्मा पॉइंट। हमारा मर्मा पॉइंट भी है, कहते हैं कि इस बिंदु को ट्रीट करने से लोगों की आवाज आ जाती है। अब आवाज क्यों आ जाती है? व्हाट इज द कनेक्शन विद द वॉइस, व्हाट इज द कनेक्शन विद द स्पीच? वी नो द स्पीच इज कनेक्टेड द हार्ट, right? Heart is responsible for speech. If the person is not having proper speech, then we are activating the heart. We are activating the heart with the help of governing vessel 16. So in the Marma Shastra, we are using this point to activate the speech, to bring the speech in a, like, to improve the speech. On the other side, if the we are hitting this point very vigorously, अगर इस point को अच्छी तरह से मार दिया, हिट कर दिया, तो व्यक्ति की स्पीच जा सकती है। यानी इस पॉइंट का प्रयोग मार्शल आर्ट में भी किया जाता है और इस पॉइंट का प्रयोग मर्मा हीलिंग में भी किया जाता है। बिकॉज दिस पॉइंट इज हैविंग कनेक्शन विद द हार्ट, सो दिस पॉइंट इज हैविंग कनेक्शन विद द स्पीच, दिस पॉइंट इज हैविंग कनेक्शन विद द नेक पेन। जब भी किसी को नेक पेन हो, आप इस पॉइंट को हल्के हल्के दबाइएगा, उसे जरूर दर्द मिलेगा, लेकिन कुछ समय के बाद उसका गर्दन का दर्द कम हो जाएगा। उसका गर्दन का दर्द कम हो जाएगा।
Though in some individuals it may be difficult to feel. 2.
In this way. So now next, clear, governing vessel 16 clear, right? Clear? Okay. Clear to everyone? Governing vessel 16? Okay. So now we are moving to the next point. Very important point. Very, very important. That is the, for we know there are many vertebrae in the neck. हमारे गर्दन में कई vertebrae होती है। Sometimes there is a little bit twisting of the vertebra twisting this side, vertebra twisting that side, and we are suffering with a neck pain. So we want to bring the harmony in the vertebra. हम vertebra में harmony लाना चाहते हैं। So we are using two very special point. हम इसके लिए बहुत ही special point का प्रयोग करते हैं। वो point कौन से? I will show you. Look at here. So look at my leg here. ये देखिए, ये पैर है। We can see the tendon here. यहाँ पर ये tendon है। You can see the tendon. What is the name of this tendon? This is called Achilles tendon. इसका नाम है Achilles tendon. Right? If we massage this Achilles tendon, it will improve the neck pain. ये हमारे गर्दन के दर्द को improve करेगा. Right? So below, on the one side we have kidney meridian. यहाँ पर हमारा kidney meridian. On the other side we are having urinary bladder meridian. यहाँ पर हमारा urinary bladder meridian. Now, if we are putting the needle in between, it is working on the kidney meridian as well as on the urinary bladder membrane. So we are putting the needle in this tendon itself. इस tendon में needle डाल देते हैं. So one needle we are putting exactly at the level of kidney 3. We know here is the kidney 3. तो यहाँ पर हम टेंडन में एक नीडल डाल देते हैं और एक नीडल दो चुन प्रॉक्सिमल डाल देते हैं. वन नीडल हियर, वन नीडल टू चुन प्रॉक्सिमल. देयर आर टू नीडल्स. हम पतली नीडल लेकर इसे डाल दे. दैट इज कॉल्ड 77.01 एंड 77.02. पुट द नीडल बायलैटरल. आप दोनों पैरों में लगा दीजिए. लेट्स सी हियर. So these are the 2.77.01 and the 77.02. This is the point given by the master tool. You put the needle bilateral in the both leg. बहुत ही इफेक्टिव पॉइंट है. आप दोनों पैर में लगा दो. 20 मिनट्स के बाद needle निकाल दो. Even you can, and after removing the needle, if the person is having pain in the neck exactly on the back side, it will definitely disappear. But a person is having pain on the lateral side, then it might not be disappear. अगर व्यक्ति का पेन एकदम बीचों बीच है गर्दन के, the person is having neck pain exactly in the central line, it will definitely disappear by the 77.01. Right? For side we have to do something different. Side के लिए हमें कुछ और भी करना होगा. ये शायद काम ना भी करे. It will be little painful, definitely. It will be little painful, so that we can use the very good quality of needle. हम अच्छी क्वालिटी की needle यूज कर सकते हैं और हम उसे लगा सकते हैं. लगाते समय क्या करिए कि पहले थोड़ा सा लगा दीजिए with a cue, right? और फिर उसे ड्रैग करके अंदर ले जाइए. Only 2 needle on the right side, 2 needle on the left side, and when you remove, जब आप इन needle को remove करें, when you want to remove these needle, remove them, then do little massage of the tendon. उसके बाद tendon की 30 सेकंड तक मसाज कर दीजिए बस. फिर पेशेंट को बोलिए अब उठ जाओ. Because if the patient is getting up after this treatment, for 2-3 minutes, patient will feel little stiffness in the leg, but after that person will be feeling very excellent. Why we are putting these point? क्योंकि ये point लगभग गारंटेड होते हैं कि इससे ट्रीटमेंट, इससे दर्द चला ही जाता है. Okay, I will show you the location in the 3D image now. Let's see here. Let's see now. So we can see here. Here we are having kidney 3 point. On the other side, we are having urinary bladder 60 point. In between, we are having this tendon. उनके बीच में ये एक tendon है. This is the tendon. The name of this tendon is Achilles tendon. On the Achilles tendon, we have to put one needle in the center here. That is called 77.01, and one needle two tune up. That is called 77.02. We can put bilateral. इसके दो नियम हैं. या तो bilateral लगा दो और opposite side लगा दो. If the person is having neck pain on one side, then put the needle on opposite side. अगर व्यक्ति कहता है कि मुझे गर्दन में दर्द एक ही तरफ है, यानी गर्दन में दर्द है लेकिन एक तरफ ज्यादा है, तो आप अपोजिट साइड में लगा दीजिए needle. So let's see in this image here. We can see this is the tendon which is called Achilles tendon. इसी को हम एचलिस टेंडन कहते हैं। निडल इसी में लगेगी, निडल इसी में जाएगी। अगर आपकी निडल टेंडन में नहीं गई तो फिर वो 77.01 और 77.02 नहीं है। अगर निडल टेंडन में नहीं गई तो, राइट, गॉट इट। तो 77.01 and the 77.02 will work on if your needle is going in the tendon. Definitely it's a sensitive point, but very effective, very effective, right? In the master to acupuncture, we have explained this in the very detail. हमने मास्टर टू acupuncture में ये दिखाया है, और जब मैंने दिखाया तो अपने पैर में लगा के दिखाया था। मैं आपको दिखा देता हूँ, चलिए। एक मेरा हमारा मास्टर टू का जो वीडियो है वो मैं आपको दिखा देता हूँ। तो जब मैं अपने पैर में लगा सकता हूँ, आप तो पेशेंट के पैर में लगा ही सकते हैं, है ना। अभिलाषा जी सो जाइए, गुड नाइट। चलिए मैं आपको लगा, ये देखिए। The name of this tendon is Achilles tendon, and we have to put the needle in the tendon, inside the tendon. So if you want to put the needle on the kidney, you will be putting here. If you want to put the needle in the urinary bladder, you are putting the needle here. But now we have to put the needle in between the kidney and the urinary bladder channel on this tendon. So what we are doing, we are telling the patient, okay, lie down. Patient is lying down, right, on the abdomen. Then we are inserting the needle in the tendon. Look at this. See, this needle is going in the tendon itself. Then gently we are putting entire needle in. You can see. Entire needle will go in, right? Okay, this is the 77.01. Then we are coming to tune up. The to tune up, there will be another needle. So we are putting the one more needle here to tune up. This needle also going in the tendon only. This is a very hard tendon. Remember, do not try to put the needle in the softest. This is very easy. This is very easy. Our needle have to go in the tendon. 77.02. Then we'll drape the needle inside. Entire needle will go inside. Entire one tune. Now again we are going to tune up. It's clear now? Video was understood? Okay, so this was video from master room. पिछले क्लास में किसी ने पूछा था, सर आप निडल कैसे लगा देते हो, आपको दुखता नहीं है क्या कि पेशेंट को निडल लग रही है, आपके दिल में दर्द नहीं होता क्या? तो नहीं, दिल में तो अच्छा लगता है। दिल में अच्छा लगता है, क्यों? क्योंकि वो ठीक होने वाला है ना। उस वो सोच के अच्छा लगता है, ये थोड़ी देख के कि इसको दर्द होगा, है ना। अब डॉक्टर सर्जरी करते हैं तो डॉक्टर को अपनी दुश्मनी थोड़ी निकालते हैं कि भैया चला जा, तूने कुछ किया होगा पहले, उसके भले के लिए करते हैं ना सर्जरी। सो वी आर डूइंग फॉर, we are not thinking that patient will be feeling pain right now. We are thinking, oh, patient will be having good effect and patient will be having very comfortable life after that. These points are very much effective. 77.012. Tell the patient lie down in the prone, उल्टा लेट जाओ और नीडल लगा दो दोनों पैरों में, बहुत अच्छा काम करती है, राइट। तो जरूर लगाइएगा नीडल, राइट, डरिए